Today, the world is in the grip of the coronavirus scare, with countries across the world declaring a state of public health emergency. One of the few places in the world which has effectively contained the spread of COVID-19 has been the state of Kerala. And as an integral part of the public health system here, the dental fraternity in Kerala owes a responsibility to join hands in this fight against the dreadful infection. This video is intended to clarify the doubts of dental professionals and help them to take informed decisions. It elaborates the specific steps that need to be taken in the current scenario and also provides checklists to effectively implement these steps. Dr. Binu Purushothaman, being the Kerala government's nominee to the Dental Council of India, do you think there is a need to shut down the dental clinics in the state?
The answer to this question depends on several factors. As you know, any epidemic has certain levels of spread. First the index cases, then the cluster level spread and the community level spread. Based on that, we have to classify those clinics in these areas where there is index level spread, then a cluster level spread, and the clinics where there is community level spread is identified. Right now, most of the areas in Kerala, COVID-19 is in the cluster level of spread. The dental clinics in those areas can certainly function provided they take some precautions. Coming to the areas where the spread is at the community level, the decision is based on certain conditions. If there are any specific government directives with regard to the functioning of clinics, we have to abide to that. In the absence of such directives, Idea Kerala State recommends all dental clinics in those areas with community level of spread to restrict their function to emergency dental care and defer all elective procedures.
The steps taken can be generally classified into those taken in the reception and those taken in the operatory. In the reception, as soon as the patient enters, the first thing one needs to do is to make sure that there is a registration process. All the personal details of the patient is noted, and along with that, a specific screening form to record the travel history and other relevant details is given. Now the patients with symptoms and without symptoms have to be classified. Patients who have symptoms like fever, cough, sneeze, running nose will have to be ideally isolated if possible, or else they have to be given a mask while they are in the waiting area and they are given priority. The waiting area should ideally have all the posters the Idea Kerala State have provided regarding COVID-19 advisories, cough, sneeze etiquette, hand washing technique, etc. All patients in the waiting area should be given a hand sanitizer before entering the operatory.
Inside the operatory, there are certain standard or universal precautions we are all familiar with. Irrespective of whether there is an epidemic or not, we are supposed to follow these precautions every day with every patient. Let us go through these standard precautions. First, there is the immunization protocol. Every dental professional and the supporting auxiliary staff should be adequately immunized. For example, against the hepatitis, diphtheria, tetanus, and the flu. Second is the personal protective equipment. Third is the sterilization and disinfection protocol. And fourth is the biomedical waste handling.
Now, apart from the standard precaution, there are certain transmission-based precautions which have to be paid attention to in the wake of an epidemic. This is based on the mode of transmission of pathogen, which is through droplets in the case of the COVID-19 virus. So, let us look at the specific precautions to be taken to prevent the spread of the novel coronavirus. First, the PPE. Here, use of goggles, face shields, headgear, and the mask are important. Second is the importance of hand wash before putting the gloves and after. The next important step before a procedure is the pre-procedural oral rinse for the patient using either povidone iodine or 1% hydrogen peroxide. This is to reduce the microbial load in the aerosol that we generate. There are three things that we can do to reduce the aerosol contamination in our clinic. First, the pre and post procedural rinses. The second, using a high velocity suction apparatus and practicing four-handed dentistry can also reduce aerosol contamination. Thirdly, we can install a quality air purifier in the operatory to reduce the aerosol load. After the procedure, the area around the chair is properly disinfected and also the materials that we touch constantly including our mobile phone, should be cleaned using an appropriate disinfecting agent.
Dr. Shajil, can you elaborate the steps taken by IDA Kerala so far to contain the spread of the COVID-19 virus?
IDA Kerala has given clear advisories to our members with regard to the specific precautions that need to be taken in the wake of the spread. We are constantly in touch with the Directorate of Health Service and is updating our members with the latest information. Together, IDA Kerala is with the authorities in the fight to contain the deadly virus.
IDA Kerala is duty bound to fulfill its commitment to our members and the profession. Believers, be with us. Together we will face this crisis and together we shall overcome it. Jai IDA, Jai Hind.